Greetings from Joy
And Dr. Martin Brown.
from Brown Chiropractic in Northfield, New Jersey. We have decided to do like an impromptu kind of question and answer kind of thing to get you to know us a little bit more. So I'm going to ask it just a question or two and we'll start from there. So what made you decide to become a chiropractor?
And that's a great question. Going way back to the 1960s, which was a while ago, I was a very young man at that time, and my dad had been going through a downward spiral of health or illness, and was not doing well at all. He had been under care ever since he woke up one day and his knees gave out on him. They said it was arthritis and put him on a cortisone drug for a long time, and as a result of that side effect of that drug, he developed diabetes and was put on another drug for that, and on and on and on. So by that point he was starting to have cardiovascular issues and heart evidence of heart disease. So
you were in at Rutgers doing
yes,
like a pre-med program?
Undergrad, yeah, in a pre-med program, right. And so I knew a little bit about anatomy and physiology, the function of the body. So he had this rapid, uncontrollable heartbeat, and so they put him into the hospital and tried to get it under control with different medications.
That seems to happen a lot nowadays too. But anyway, back to that.
Yeah. After a couple of weeks in the hospital, he wasn't making any progress, and they said he wasn't going to get any better. So they discharged him and told my mother that he probably only had a few months to live at that point. So being a young, naive student, I decided to look into different options.
He was only around 60 at that time too, right?
Yeah, that's right. And so I started to look at different options and wound up going to health food stores, which were not a normal mainstream thing back then.
Right. Hippies hung out.
Yeah, mostly weirdos. So anyhow, I was in health food. Oh, and I had purchased different things. I had my dad taking apple cider vinegar and some supplements and vitamins and things. And they all helped a little bit, but nothing really made a significant difference. He continued to get weaker and sicker. And then one day when I was in one of these stores, one of the other customers said, "You should take your dad to a chiropractor." And I said, "What's that?" And he said, "Well, just go and you'll learn, you'll find out." And so we found somebody nearby in the phone book, which we used to use in those days, and made an appointment and brought him into the office. And his office was on the second floor of a building with an outside staircase, which were more common back in those days.
Right.
You didn't see too many office.
No, they have elevators now.
Yeah, not back then.
Yeah.
So to get him into the office, I was under one shoulder and my brother was under the other, and we were almost carrying him up the steps into the chiropractor's office. And he went in and got an exam and x-rays and was ready for his first adjustment. And so they put him on the table and he got his adjustment. And just as we've seen a few of these miraculous responses during the years in our practice, that was what happened that day. My dad got off the table on his own, was able to walk around out of pain on his own strength
With one adjustment.
with one single adjustment. And that was a miraculous experience for me. And it was when I decided that if that chiropractor could change my dad that much with no side effects, no invasive procedures, that was something I wanted to pursue, to help people the way that he had helped my dad.